Let me talk about few question and answer. The first question here, a primary care nurse prescribing a drug to a 80 years old African American woman. When selecting a drug and determining the correct dose, the nurse should understand that the knowledge of how age, race, and gender may affect the drug excretion is based on an understanding of number A, bioavailabilities, number B, pharmacokinetics, number C, pharmacodynamics, and number D, anatomy and physiology. So the examiner asking which branches, basically we talk about the medication, how affected the age, race, gender, and also how drugs eliminate from the body. Particularly in pharmacokinetics, we discuss all of them. The correct answer is B, pharmacokinetics. So what is pharmacokinetics? It is the branches of pharmacology, or it is the study of the action of drugs in the body and may be thought of as what the body does to the drugs. Factors such as the age, race, gender may change the way the body acts to metabolize and excrete a drug. Bioavailabilities refer to the amount of drug availabilities at the site of action, and pharmacodynamics is the study of the effect of drugs on the body. Anatomy, basically the structure of human body, and physiology are the function of human body. Anatomy and physiology is a basic understanding of how body function or what are the structure. Second question said, a patient asks the primary care nurse which medication is used for mild to moderate pain. The nurse should recommend it APAP or Tylenol, acetaminophen, or D, any over-the-counter pain product. So when patient has a mild to moderate pain, we give them acetaminophen, number C. So you can ask me why number B is not an answer and why number C is the answer, because Tylenol also acetaminophen. Acetaminophen are generic name, but Tylenol are the business name. So always we should provide the drugs generic names. So explanation said providers should use generic drugs name when prescribing the drugs or recommending them to the patients, unless a particular band is essential for some reason. Because the acetaminophen can have many trade names, and it is important for patient to understand that the drugs is the same for all to avoid overdosing on acetaminophen. And APA is a Commonly use abbreviation but should not be used when recommending the drugs to the patient. The next question here, a patient wants to know why a cheaper version of a drug cannot be used when the primary care nurse writes a prescription for a specific brand name of the drugs and writes the dispense is written. The nurse should explain that the different brands of these drugs, number E, may cause different adverse effect. Number B, does not necessarily have the same therapeutic effect. Number C, is likely to be less safe than the brand specified in the prescription. Or number D said, may vary in the amount of drug that reach the site of action in the body. So correct answer is D, means may vary in the amount of drug that reach the site of action in the body. The explanation, the different formulas of the same drugs may have a varying the degrees of bioavailabilities, and it may be important to stick to the particular band of drugs with a narrow therapeutic range. All drugs with the similar active ingredients should have the same therapeutic action and same side effect, and also should be equally safe. The next question, a primary care nurse wishes to order a drug that will be effective immediately after administration of drug. Which route should the nurse choose? Number A, rectal, B, topical, C, sublingual, and D, intramuscular. So examiner asking, out of 4, which one is immediately be active? It is sublingual. Answer C. Why? The sublingual route is preferred for quick action because the drug is directly absorbed into bloodstream and also avoid the pass through the liver, where much of an oral drugs is metabolized. Rectal route have unpredictable absorption rate, and topical route are the lowest. Intramuscular route are slow. Next question, a patient receive an inhaled corticosteroid to treat asthma. The patient asks the primary care nurse why the drug is given by this route instead of orally. The nurse should explain that the inhaled form, number A, is absorbed less quickly. Number B, has reduced bioavailabilities. Number C, has fewer systemic side effects. Number D, provide dosing that is easy to regulate. So usually when a patient have a asthma, we give them inhaled form of steroid like corticosteroid inhaler or ibuprofen. So your patient asking, why you giving inhaler? Why not give orally? The best response, they said, number A, is absorbed less quickly. Number B has reduced bioavailabilities. Number C has a few systemic side effects. And D, provide dosing that is easy to regulate. The correct answer is C, has a few systemic side effects. When you give inhaler form, because you are avoiding the oral form. The explanation: an inhaled steroid or corticosteroid goes directly to the site of action and does not have to pass through gastrointestinal tract absorption or the liver to get to the lungs. It is generally well absorbed at this site, although dosing is not necessarily easy to regulate because it is not always clear how much of an inhaled drugs gets into the lungs. Next question. A patient takes an oral medication that causes the gastrointestinal upset. The patient asks the primary care nurse why the drug information insert cushion again using the antacid while taking the drugs. The nurse should explain that the antacid may alter the drug absorption. Number B, alter drug distribution. Number C, lead to drug toxicity. Number D, increase the stomach upset. So correct answer is alter drug absorption. The explanation: changing the pH of gastric mucosa can alter the absorption of the drugs. Drug distribution is not affected. It may indirectly cause drug toxicity if a significant amount more of the drug is absorbed. It would decrease the stomach upset. Next question. A patient will begin taking two drugs that are both protein bound. The primary care nurse should: number A, prescribe increased doses of both drugs. Number B, monitor the drug's level, action, and side effect. Number C, educate the patient to increase intake of protein. Number D, stagger the doses of drugs to be given 1 hour apart. So the correct answer is B, monitor the drugs level, monitor the action of the drugs, and side effect. The explanation: protein-bound drugs bind to the albumin, and serum albumin level may affect how drugs are distributed. The provider should monitor the drug levels, actions, and side effect and change doing the accordingly. Increase the drugs of both drugs is not recommended unless the monitoring indicated. Also, increased dietary protein does not affect this. Also, staggering the drugs will not affect this. Question: a patient is taking drug A and drug B. The primary care nurse note increase the effect of drug B. The nurse should suspect that in this case, drug A is a cytochrome P450 enzyme, number A, inhibitor, number B, substrate, number C, inducer, number D, metabolizer. Correct answer is the inhibitors. Rationale: if the drugs A is cytochrome P50 enzyme inhibitors, it decreases the capacity of enzyme to metabolize the drug B and causing more of the drugs B to be available. And A substrate is a drug acted on by the enzyme. If drug B is an enzyme inducer, it would increase the metabolism of drug A. Question: the primary care nurse should understand that a drug is at a therapeutic level when it is, number A, at peak plasma level, number B, part 4 or 5 half-lives, number C, at the steady plasma state, and D, when between minimal effective concentration and toxic level. The correct answer is number D. The explanation: the therapeutic range of a drug is the area between the minimal effective concentration and the toxic concentration. And peak plasma level is the highest level of drugs, and this level of drugs is reached and maybe well into toxic range. The steady state occurs when there is a stable concentration of drug and generally occurs after 4 or 5 half-lives. Next question: a primary care nurse is preparing to prescribe a drug and note that the drug has non-linear kinetics. The nurse should: what is non-linear kinetics? Number A, monitor frequently for desired and adverse effect. Number B, administer as much higher initial dose as a loaded dose. Number C, monitor creatinine clearance at baseline and periodically. Number D, administer the drugs by a route that avoid the fast pass effect. The correct answer is A. Monitor frequently for desired and adverse effect. Rationale said the drugs with non-linear kinetics are not eliminated based on the dose or concentration of drug. And these drugs have a narrow therapeutic index and must be monitored closely for desired effect and toxicity. Next question: a primary care nurse is prescribing a drug for a patient who does not take any other medication. The nurse should realize that A, cytochrome 450 enzyme reaction will not interfere with the drug metabolism. Number B, substrate such as alcohol cannot interfere with the drug when the patient is abstaining. C, food-drug interaction are limited to those where the food enhance or inhibit the drug absorption. D, a thorough history of diet, alcohol use, smoking history, or over-the-counter and herbal product is required. So they said during taking the history, we always evaluate Hmm? So number D is a correct answer. Drugs are not the only substance that interfere with drug kinetics or dynamics. The primary care nurse should conduct a thoroughly history of food or alcohol intake, smoking history, over-the-counter medication what intake, and also the herbal supplement to identify things that might interfere with the drugs. All of these may interfere with cytochrome 450 enzyme. Alcohol intake can influence this even when patient is abstaining because of long-term effect of the liver. Next question. A nurse is considering a possible drug regime for 80 years old patient who report being forgetful. To promote the adherence to the regime, the nurse should, number A, select the drugs that can be given once or twice daily. Number B, provide details written instruction for each medication. Number C, order medication that can be given on an empty stomach. Number D, instruct the patient to take a lower dose if side effect occur. The correct answer is A. Select the drugs that can be given once or twice daily. Why? Your patient is 80 years old and being forgetful. Explanation: to promote adherence in elderly patient, selecting some smallest number of medication with the simplest dose regime is recommended. With once daily dosing always preferred. Instructions should be simplified, and drug dosing should be timed with mealtime to help the patient remember to take them. Lower dosing may be necessary with some drugs, but patients should not do this without consulting this provider. Next question. A 75 years old patient who lives alone with being taking a narcotic analgesic for pain. To help ensure the patient's safety, the nurse prescribing this medication should, number A, assessing this patient's usual sleeping pattern. Number B, ask the patient about problems with constipation. Number C, obtain a baseline creatinine clearance test before the first dose. Number D, perform a thoroughly evaluation of cognitive and motor abilities. The correct answer is D. Because 75 years old patient living alone, taking narcotics, it is important to check or evaluate the cognitive function and motor abilities because chance of falling and falling prevention is the priorities. The explanation: the body system most significantly affected by increased the receptor sensitivity in elderly patients is the central nervous systems, making this population sensitive to the numerous drugs, the numbers drugs. And it is important to evaluate the motor and cognitive function before beginning the drugs that affect the central nervous system to minimize the risks of falling. Also, assessment of sleeping pattern is important, but not in relation to patient safety. And it is not necessary to evaluate the stool pattern or renal function. Next question. A thin 90 years old patient who will begin taking warfarin has experienced a recent weight loss of 15 pounds. The nurse caring for this patient should A. Obtain a baseline liver function test before starting the drug. Number B, write the initial prescription at the lowest possible dose. Number C, encouraging the patient to consume a diet high in the fat and protein. D, counseling the patient to take the drug with food to and increase the absorption. So correct answer is B. Write the initial prescription at the lowest possible dose. Your patient is 90 years old, taking warfarin, experienced recent weight loss 15 pounds. The rationale, a common age change that affect the distribution drug in older adult is a decrease the serum albumin. Significant change that may affect the drug therapy may be seen in malnourished elderly patient. Warfarin has a high binding affinity with the albumin. Significant decrease in albumin may result in a greater free concentration of highly protein-bound drugs. It is very important to order the lowest possible dose and also titrate upward as needed. Next, a 86-year-old patient is seen in the clinic for casual follow-up after starting a new oral medication 1 month prior. The patient report no change in the symptoms and a laboratory test revealed a subtherapeutic serum drugs level. The nurse caring for this patient should A. Consider ordering more frequent dosing of the drugs, titrate the patient's dose upward or recheck in 1 month. Number C, ask the patient about any increase the frequency of bowel movement. Number D, determine the number of pills left in the patient prescribed bottle. So correct answer is the D, determine the number of pills left in the patient prescription bottle. The explanation, because of cost concern, the poor understanding of a drug's action, or confusion about how to take a medication, may elderly patients do not comply with the drug regime and may not take drugs as prescribed. Before increasing the frequency or amount of a drug, it is important to assess the past where or not the patient has been taking the drugs as ordered. Also, counting the number of pills in the bottle will help provider assessment whether the drug is taking the drug as ordered. Changing in gastric motility do not generally have the measured effect on effectiveness or serum drugs level of the medication. So question here, a nurse learned that 90 years old patient is chronically constipated and has frequent problem with acid reflux. The nurse noted a weight loss of 20 pounds in this patient in previously 6 months. Which of the following drugs that this patient is taking in cause for concern. Number A, quinidine. 2, nephroxen. Number C, calcium citrate. Number D, calcium channel blocker. Answer the nephroxen. Number B. Why? Nephroxen has a high binding affinity for protein, and these drugs can become toxic in patients who may have low serum albumin because of amount of the free drug in serum. Constipation and acid reflux may cause the problem with absorption for some drugs, but not the drugs listed. Question A, nurse is caring for a 70-year-old patient who report having seasonal allergies with severe rhinorrhea. And using the Beard's criteria, which of the following medication should the nurse recommended for this patient? A, loratadine. B, hydroxyzine. C, diphenhydramine. D, chloramphenicol malate. The correct answer, loratadine, is the only non-sedating antihistamine on this list. Older patients are especially susceptible to sedation or sedation side effect and should not use this medication if possible. So loratadine is antihistamine but not sedative drug of choice. Next question. A nurse ordered an inhaled corticosteroid to Pharm twice daily and an albuterol metered dose inhaler to Pharm every 4 hours is needed for cough and for wheezing for a 65-year-old patient with recent onset of reactive airway disease who report the symptoms occurring every 1 or 2 weeks. At the follow-up appointment several months later, the patient report no change the frequency of symptoms. The nurse initiate the action should be to A, order the spirometry to evaluate the pulmonary function. Number B, prescribe a systemic corticosteroid to help with symptoms. Number C, ask the patient to describe how medication are taken each day. Number D, give the patient details information about the use of metered dose inhaler. The correct answer is C. Ask the patient to describe how the medication are taken each day. Because your patient has a bronchial asthma or respiratory problem, your patient taking corticosteroid inhaler or albuterol, salbutamol, ibuprofen or metered dose, sometimes patients do not know how to use it. So explanation said, it is essential to explore with older patient what he or she is actually doing with regard to daily medication use and compare this again the prescribed medication regimen before ordering further test. Also, prescribing any increase in medication or providing further education. Next question. A nurse is preparing to prescribe a medication for a 5-year-old child. To determine the correct dose for this child, the nurse should A, calculate the dose at 1/3 of the recommended adult dose. Number B, estimate the child dose, the child body surface area to calculate medication dose. Number C, divide the recommended adult dose by the child's weight in kilogram. Number D, follow the drug manufacturer's recommendation for medication dosing. So correct answer is D, follow the drug manufacturer's recommendation for medication dose. So pediatrics medication always is described very well, how to prepare, how to take it. So the package insert provided by manufacturers is the best source for pediatric dose recommendations. Approximated reduction in the adult dose is not a safe or effective way to calculating pediatric doses for medication. So using a third of the adult dose may not be safe. Error increasing or inherent in determining the body surface area make this method less reliable than the dose based on accurate body weight. Also, dividing the adult dose by the child body weight is not the way to calculate the medication. Next question. A nurse is prescribing a drug that is known to be safe in the children, but is unable to find recommendation about drug dosing. The recommended adult dose is 100 milligram per dose. The child body weight 14 kilogram, and using the Clark rules, so what the nurse should order per dose? The answer 20, 10, 14, 9.3. The correct answer is 20. How we calculate? According to the Clark rule, suggest that divided the body weight of the child in kilogram by the weight of an adult in kilogram. Also multiplying the result by the adult dose to get approximation of the child dose. The average adult weight 150 pound or 70 kilogram. So equation should be 14 kilogram over 70 kilogram. It is 0.2. And when you multiply it to milligram, it would be 20. Next question here. A child who body weight 22 pound 2 ounce need a medication. The nurse learns that the recommended dose for this drug is 25 to 30 milligram per kg per day in 3 divided doses. The nurse should order. So number A, 100 milligram daily. Number B, 100 milligram TID. Number C, 300 milligram daily. And number D, 300 milligram TID. First of all, number A is not an answer because 100 milligram daily. But in the question, examiner already mentioned 3 times divided doses. Same as number C is not an answer because 300 milligram daily. We need 3 times, shortly called TID. Answer either B or answer either D. The correct answer is 100 milligram TID B. Why? The nurse should first convert the child body weight to kilogram. Here we can see the body weight is pound. Pound have to convert it to kilogram, which is about 10 kilogram, because we know 1 kilogram equal to 2.2 pound. The dose is then calculated to be 250 to to 300 milligram per day in 3 divided doses, which would be 83 to 100 milligram per dose is given. So answer is B. Next question, a mother of a 3 years old child who weight is 15 kilogram tells the nurse that she has a liquid acetaminophen at home, but does not know what dose to give her child. The nurse should tell the mother A to give 1 teaspoon every 4 to 6 hours as needed. Number B, to throw away the old medication and get a new bottle. Number C, that she may give 5 to 7.5 milligram dose every 4 to 6 hours. Number D, to find out whether she has a preparation made for infant or children. The correct answer is D, to find out whether she has a preparation made for infant or children. Acetaminophen drops for infant are 3 times as concentrated as the oral liquid for children. The drops have been pulled from market, but many parents may still have old preparation on the hand. The nurse should first determine which preparation this mother has before giving the dosage recommendation. If the mother has the oral liquid for children, answer A and C would be both be acceptable because the concentration is 160 milligram per 5 ml. The mother should not counsel to throw away the medication until the nurse has more information. So first of all, the correct answer is to find out whether she has a preparation made for infant and children. Question, a mother of a 3 years old child whose body weight is 15 kilogram and tells the nurse that she has a liquid acetaminophen at home, but does not know what dose to give her child. The nurse should tell the mother A to give 1 teaspoon every 4 to 6 hours as needed. B, to throw away the old medication and get a new bottle. And C, that she may give 5 to 7.5 milligram per dose every 4 to 6 hours. And number D, to find out whether she has a preparation made for infant and children. The correct answer is D, to find out whether she has a preparation made for children and infant. Acetaminophen drops for infant are 3 times as concentrated as the oral liquid for children. The drops have been pulled from the market, but many parents may still have an old preparation on the hand. The nurse should first determine which preparation this mother has before giving the dose recommendation. Next question. A parents of a toddler asked the nurse about using a topical antihistamine to treat the child atopic dermatitis symptom. The nurse should tell the parents that number A, topical medication have fewer side effects in children. B, medication given by this route are not absorbed well in the young children. C, topical application of an antihistamine may result in a drug toxicity in the children. And D, it is important to apply topical medication liberally over a large surface area. Correct answer C. So topical application of an antihistamine may result in a drug toxicity in the children. Children have the potential for increased absorption through the skin because the skin is thinner and more sensitive, increasing their risk for drug toxicity. Also, topical medication have enhanced the side effect in the children, and topical medication are readily absorbed by the children. Also, applying the topical medication over the large surface area would increase the risk of toxicity. Next question. A nurse is preparing a medication for 6-month-old infant. The medication comes in the following formulation. Which one should the nurse select to improve the absorption and distribution of medication? Number A, oral analgesics, rectal suppository. Number C, lipid soluble compound. And number D, sustained release capsule. The correct answer is number E. Because oral elixir is a solution in which the drug molecule are dissolved and evenly distributed. Most oral drugs is soluble solution are readily absorbed from gastrointestinal tract, and the fact that the drug is evenly distributed and helps to ensure that each dose will have equal amount of drugs. Next question. A nurse prescribed an oral elixir medication for the child who is to take 1 teaspoon orally BID twice a day. When counseling the drugs parents about the administering these drugs, the nurse should tell them to A, before use, it is good to checking well the medication before giving. Mix the medication with cereal to improve its taste. Number C, admin the medication on an empty stomach to increase the absorption. Number D, use a syringe that you bought at the pharmacy to measure the medication accuracies. Answer is D. So you can use a syringe that you purchased at the pharmacy to measure the medication accurately. Next question. A 4-month-old infant has a viral illness with a high fever and cough. The infant parents ask the nurse about what to give the infant to help with the symptom. The nurse should prescribe with one of the following. A, aspirin to treat fever, acetaminophen is needed. C, dextromethorphan for coughing. Also, antibiotics to prevent increased infection. Correct answer, acetaminophen is needed because patient has a high fever is needed. Why? Number B is the answer. Infant should not be given aspirin. Chance of aspirin toxicity. We call Rayleigh syndrome. Dextromethorphan also can toxicity, which has increased the risk of respiratory depression in infant. And antibiotics is not indicated unless there is a known bacterial infection. So acetaminophen is safe for infant who have a high fever and cough. Question A, parents bring 5-year-old child to a clinic for a hospital follow-up appointment. The client is taking a medication at a dose equal to adult dose. The parents report that the medication is not producing the desired effect. The nurse should A. Order the renal function test. B. Prescribe other medication to treat the child's symptom. C. Discontinue the drugs and observe the child for toxic side effect. Number D, obtain serum drug level and consider increase the drug dose. Correct answer is D. Why? By the child's first birthday, the liver metabolic capacity are not only mature but also more vigorous than the adult liver, and measuring that certain drugs may need to be given in higher doses or more often. It is also pursuant to obtain the serum drug level and then consider increasing the dose to achieve the desired effect. Next question. A nurse prescribing an antibiotics for a child who will need to take a total 750 milligram per day. Which dosing regimen should the nurse prescribe to promote the compliance? The correct answer is C, 500 milligram over 5 ml to 375 milligram POBIT twice a day. To improve compliance with the drug regime or convenience, dose forms and dosing schedule should be chosen when possible. A 500 milligram and 5 ml solution preparation means that a small volume can be given to achieve the desired dose, right? And next question, a nurse sees a preschooler in clinic for the first time. When obtaining the medication history, the nurse notes that the child is taking medication for which safety and effectiveness of children has not been established in the drug information. So the nurse should do for what? A, discontinue the medication. B, order the serum drug level to evaluate the toxicity. Report the prescribing provider to the FDA. And number D, ask the parents about the drug's use and side effect. The correct answer is D. Ask the parents about the drug's use and side effect. Many of the drugs and biologic products most widely used in pediatrics patient carry the disclaimers starting that the safety and effectiveness in pediatrics patient not been established. The nurse should find out why the drugs was prescribed and whether there are any significant side effect. And the medication should not be discontinued unless there are known toxic effect.